Hello.
Hello?
Hi. Finishing up your call? Hello, can you hear us?
Can you hear me?
Yep, I can hear you. Can you hear me?
Hello?
Yep,
Oh, okay.
I can hear you. Can you hear me?
Yes, I can hear you.
Can you hear me?
Yes,
Oh, great.
I can hear
Okay,
you.
thanks.
Oh, sorry. I had a patient
No worries.
emergency. All right. How's it? How are you?
Good.
Okay.
We are just waiting. We'll get started in a minute or so.
Okay, sounds good. And you want me to just record, right, as well?
Yes, with the voice memo on your phone.
Sounds great.
Great. Did you start it on the phone?
Yeah. Give me a second. Okay.
Okay.
Oh, I've started it. Yeah.
Okay. Wonderful.
Julia, just to let you know, it looked like there was an incorrect link that was sent for Zoom, so I just resent it to all the attendees. So.
Oh, great. Okay.
Yeah, so that's why now people are.
Give them a minute to come in, right? Okay.
Yep.
I was going to say, I was like, when it opened up, it was okay.
Yeah.
How close do I need this to me to record? Voice memo.
Just about, probably about 6 inches is ideal.
Okay.
You could have it propped up or just hold it.
Okay, I can hold it too.
Wonderful. Thanks for everybody trickling in. We are just giving a few more seconds for folks to join since we know that that an updated Zoom link has been sent out. And then, Sun, we have you until 4:30. You have a hard stop at 4:30, or can you go a few minutes over?
I can go a few minutes over.
Okay, wonderful. That's great. And especially during these times, there's also technical difficulties with Zoom.
Oh, yes. I deal with that every day.
Well, folks joining in, welcome to the MIT Club of Northern California Front Lines series. There was an updated Zoom link sent out, so we're just giving folks an opportunity to trickle in. And thank you all for joining on a Friday afternoon. We know by now this is about the 145th Zoom call that everybody is on, so we appreciate everybody tuning in today. All right, Sun, I think we'll go ahead and get started. Are you ready?
Yeah, sure.
Great. So hello, everybody. Welcome to the MIT Club of Northern California's Frontline series. Today, we are honored to have Dr. Sun Yu here with us. Dr. Yu practices as an internal medicine physician at UCLA, where she is a medical director of the extensivist program in care transitions, focusing on comprehensive care for medically complex patients. She is a residency continuity clinic director for the internal medicine residency program and director of the health systems and management pathway. Sun has been on the front lines of COVID even before it arrived to Los Angeles. She started the COVID ambulatory monitoring program to deliver comprehensive care for COVID-19 patients that are being treated at home, as well as to closely monitor COVID-19 patients being discharged from the hospital. She received her MD from Harvard Medical School, her MPH from Harvard School of Public Health, and her undergrad degree in Course 9, Brain and Cognitive Sciences from MIT. Thank you so much, Dr. Sun. We are honored to have you on our series today.
Thanks for having me.
Great. So my first question to you, as the days go by, this is looking more like a marathon especially for doctors, and it seems like there's a long road ahead of us. How is the sentiment, and how is it being on the front lines as a doctor and a leader of your clinics?
Yeah, so, to be honest, I think the initial sentiment was disappointment that, it's hard not to know what the next few months, years, and future will look like. But, I think you're absolutely right. This is a marathon. It's naive to think this will be something self-limited and everything will go back to how it used to be. We'll just have to really get used to a new norm. But as a doctor, this is a time that providers don't know what's happening, and we're really attuned to that. Our patients are very scared too. So as a doctor, I've tried to reach out to all of my patients to make sure that they understand what's going on and know they can protect themselves during this time. There's a lot in the media, some things more true than others. And I like to really take the time to explain what we're seeing on the front lines, what we're seeing in the new studies that are coming out, and how this really applies to them and their health. And really try to help elucidate what's truth, what's myth as well, because it's a very uncertain time for all of us. In terms of more in the leadership role, I think part of it, what we're really making sure is that we're staying connected during this time. We're connecting frequently, taking time to really talk through and process what's happening. And for my team, I really encourage self-care during this time too. We're really going to have to stay well for our patients. So I really encourage our docs to have time for themselves, have time with their families, take some time to disconnect, because that's really how you're going to renew. And also, it's really about honing in on what our values, what our mission is, why we really went into medicine in the first place, and figuring out our roles in this pandemic. I do think having that sense of purpose does mitigate burnout. So it's a great opportunity, not just for those in healthcare, but outside of healthcare, to really reflect on that.
That's great. And I think you touch on a really important point about just wellness, right? And mental wellness as well. And this will definitely have an impact for essential workers and those on the front lines. So, how are you thinking about mental health and how some doctors and nurses and essential workers will cope with the aftermath of this?
Yeah, so I think about this every day, actually, for my team, for my patients, for our staff. It's something we haven't seen before. And I think sometimes we're so busy, or you're running around and you're trying to do your job, you don't even take a minute to really reflect on how it's impacted you or impacted all of us from that perspective. So I do think about that a lot. And I do think institutions are starting to think about that a lot, making sure that there are resources for wellness, for mental health, and also really making sure we're evaluating that in our patients too. Sometimes they may not even really realize how much it's impacting them until we really explore and talk through it.
Great, thanks. And I know you have been seeing COVID patients for a few months now. How has that experience been, and any surprises with the experience thus far?
Yeah, so it's been a learning curve, that's for sure. There's a lot we still don't know. There's a lot we're learning every single day. And, we're not as used to that. This is a disease process that every day there seems to be something new coming out. So really keeping up on that and connecting with those across the country and across borders to see best practices, what we're learning, sharing it with each other. I think it's something that we're not used to. But it's also, I would say, compared to when it first started, there are things we have learned. So we are becoming more comfortable with it. And the piece that I really focus on is for patients, COVID patients that are treated outside of the hospital. What we see in the news are the patients that are very sick, hospitalized in the ICU, but there are also a lot of patients being treated at home. some of it's through telehealth with their doctors, some of it's on their own, but there's a lot that we're doing outside of the hospital. And then also after patients are discharged from the hospital to make sure that they're getting better and that we're really like helping them see this whole process through. So it's really been learning. I would say that's the biggest thing. Uh, so yeah, I think that's like the biggest piece where it's just a learning curve and we're learning from each other.
Mm-hmm.
And I think you just have to be really adaptable during this time.
Right, definitely. It's definitely testing leadership and patience and everything, right? Adaptability is the key word right now.
Yeah.
Can you tell us more about the COVID ambulatory monitoring program that you started?
Yeah, so what we've started is a program for patients that are not hospitalized. So, we're treating in the clinic or through telehealth, through video visits in their homes. So there are some things that we do. Some patients, we are setting up daily video visits with them to check on them. We're also working in remote monitoring where we're able to get them pulse oximeters to really monitor their oxygen levels at home, because that really is helpful in determining whether or not a patient may be able to be treated at home safely or whether they may need to go into the hospital, into the emergency room and admitted. So we're we're trying to build out this infrastructure that we have a team taking care of these patients, and also so we can help work with our primary care doctors and infectious disease specialists and pulmonologists and making sure our patients get the best care possible.
Great. And any common things that people and patients may be overlooking or that isn't obvious that we should do to stay safe and protected?
Yeah, well, now this is a world where we're all wearing masks in a sense, some form of mask, whether it's homemade, whether it's a surgical mask, whether it's an N95. I do see that, we're used to wearing masks a lot in the healthcare field, but many people are not. It is uncomfortable, but it is just so important that everyone is wearing it and also making sure that they're wearing it correctly. Some things we see masks on people's chins, or we see people setting it aside and then they touch the outside of their mask and then they touch their face. So just really remembering that, thinking about what's contaminated versus not, like the outside of your mask is contaminated. Don't touch the outside and then start touching your face or start eating. So being very thoughtful about that. And that's the same thing with gloves, for example. If you're wearing disposable gloves, just think about what you're touching. Like if you're touching everything at the store and then you're touching your cell phone, just being mindful of that piece. And I think that's one thing. And another thing is, I do think right now there's a lot coming out about antibody testing. I think there is a lot of, there's a lot of hope there, but also right now, I do think we do have to be cautious that we're not, these tests aren't perfect yet. There's a lot that, there's a lot of room for improvement, but there is also a lot of economic incentive for companies to get these testing out. And we feel like it's our way out, but it's also important that we don't have a false sense of security until we can really rely on these tests and know what positive antibodies mean. It doesn't always confer, we don't know whether or not it confers immunity, and there's a lot of studies being done right now. So just making sure that we're continuing to practice social distancing and being safe until we know more.
And is there a risk then for the public to become complacent if they do take one of these antibody tests and it comes up with a false positive and they say, great, I can breathe in all the COVID air that I want? Is there any talk of that in the medical community?
Oh, absolutely. I think that that's a big, as these tests become more available through clinics, through different laboratories, through, places you find on the internet or cash pay, whatever there is, I think we have to be very careful. And for every patient that's interested in antibody testing, I actually, we set up a phone call to really discuss what it means, because it really depends on there are a few factors that really it depends on, but it's important that we evaluate what kind of clinical symptoms that they have had and whether that seems to be consistent with COVID, or whether they were completely asymptomatic, as well as what areas they're in. If you're in an area of low prevalence and you didn't have any clinical symptoms consistent with COVID, then then it is more likely that you'll see a false positive in someone like that. So I just make sure that I want patients to have all the information possible and be counseled on it so that they don't just start relaxing social distancing measures prematurely. So I do think there is a lot of hope in this area, but just to be careful, and for those looking, interested in this, making sure you do your research, that you talk with your medical providers to really talk through whether or not it's the right thing to even get the testing. I think that's the most important part.
Right. And I know that California, or is it Los Angeles, that is offering free testing for everyone. Is that true?
Well, our testing, our testing capabilities have really gone up. Like, for example, in our health system, we do a lot of in-house testing here, and the county does a lot of testing. So I do see that the testing capabilities have gone up significantly. Whether in terms of accessibility to specific areas and neighborhoods, that's something that we have to continue to focus on as well, to just make sure everyone has equal access to these tests. But yes, we are seeing that it is a lot easier to get this testing, which is important in terms of really getting a hold of this pandemic, I would say.
Mm-hmm. I see. Going back to the topic of social distancing, we have been hearing and seeing on the news that there are several states that are lifting measures as of May 1st, which is today, and several other states planning to do so. What are your thoughts on this, and what should the public do to prepare themselves as social distancing will lift in some areas?
Yeah, we do see that some areas, even counties here, Ventura County, for example, had opened their beaches briefly, and then now they're closing it up. I think we just have to be very careful about this in terms of where we open up and how quickly we open up, and also just vigilant that when you're going out, you have a mask on, that you are not going in areas where there are a lot of people. And I think we're just going to have to monitor really, really closely and open it up very slowly and really see what we learn as we start this process. For people that are at higher risk of complications, especially, some of my patients, I'm really encouraging them to wait, even if things open up, wait a little bit longer to see how opening this up impacts COVID and its spread before really going out. So I think people just have to be very careful. Just because you're allowed to doesn't mean you should, in terms of starting to go out into public places and to beaches and restaurants, whatever may be opening up soon.
Great. So to be extra cautious for yourself, regardless of what is going on policy-wise.
Yeah. Yep.
And then we have a question from the audience actually about at what oxygen levels would you admit a patient to a hospital?
Yeah, so that's a great question. It really depends. So there are levels that we look at, for example, if it's less than 94, we may be paying close attention, but it also really depends on what your baseline is and what your risk factors are. So patients that are at higher risk, we may have a lower threshold to admit to the hospital, and also clinical trajectory. Are you getting sicker? Are you feeling better? Is it about the same? That will definitely play into it, as well as what kind of support and close follow-up that you actually have in the outpatient system. So it's a complex answer. We don't have one number that we focus on. We really tailor it to the patient and their risk factors and their clinical symptoms and clinical trajectory.
So it's really a holistic, tailored point of view, not a hard and fast rule.
Yeah, it's not a hard and fast rule. We really tailor it to each patient.
Great. And how is this impacting the rest of UCLA and the medical system? I know that hospitals have been reallocating their resources, their bed spaces, even their personnel towards COVID-19.
Yeah, so I can't speak of exactly from UCLA how they're approaching it, but what I see from the front line and the provider side is that, there's been a very robust response to ensure that all the resources go toward getting this pandemic under control. And, that there is a system, a group that really looks at, when you start opening up procedures and other services. But I would say throughout this whole thing, we've been available to our patients. There's not a moment we've not been reachable or available. Like we've continued, like in our clinics, we've continued seeing patients in clinic if they need to. We've continued doing video visits, telephone visits, done everything in our power to connect with our patients in a time that they're scared, and understandably so. We've tried to do a lot on our end to just make sure we can stay connected to our patients during this time.
And is there any fear around the externalities that may happen from just the focus on COVID, where patients who have minor symptoms are just waiting, and by the time they're coming in, perhaps the symptoms have worsened, their conditions have worsened? Is there any fear around delayed treatment having negative impact on patient health?
Oh, absolutely. I think we all are thinking about this. In terms of patients deferring necessary care that they need to get their chronic conditions under control, I really do worry that sometimes you put it off and patients will come in sicker. What we've been doing is trying to be proactive and reaching out to patients to really make sure that their diabetes is controlled, that they're continuing to get an exercise, that they have all the medications that they need, monitoring their symptoms. I do think this is a time that it's important to be connected to a health system for this reason, because you can continue really making sure that your chronic conditions are under control and that you're not just deferring and waiting for things to get really bad. Because I do worry that some patients are putting off care that they may need. So I think many health systems are doing this now, trying to reach out to their patients and connect with them. So that's really, what we've been trying to do, and I've been trying to do as a provider.
I see. And how has the shift toward telemedicine and telehealth been going? Has that been a pretty smooth transition, or has it been? Have there been any unforeseen challenges along the way?
Yeah. So for telemedicine, our group has actually been doing this since last year. We've been doing video visits with our patients, so it was a little smoother for us. I do know that some providers that this is their first experience with it. So systems that weren't ready for this, I know have had much bumpier transition, whereas the institutions that have been preparing for this or have a component of this, it's been a little smoother. However, that being said, it's a complete change in our workflow. And it's not always the easiest to use for all of our patients and other patients. I think that this is the way that they're going to want to get a lot of their care in the future, because it is a convenient way to connect. So I think day-to-day provider level, it's really changed the workflow and trying to figure out what role do staff have in this, what role do the physicians have in this. But for us, it's been more smooth because we've been preparing for this. But I would say my colleagues and friends that I have in other systems where this is new to them, it's been a lot more difficult.
I see. We have a question from the audience asking about your thoughts around less invasive treatments versus ventilator use.
Yeah, so there's a lot of different there's a lot of studies looking into that, and even here we are looking more into that in terms of more or less invasive treatments. But again, I think a lot of it depends on the patient and their clinical picture. So I don't think we know enough right now to make a blanket statement around this.
Mm-hmm. Okay, great. And then we have a question around long-term care facilities. I know there's been a lot of press around elderly care and just mass infections in the long-term care facilities. Do you have anything that you could speak about regarding these?
Yeah, there's not a blanket statement I could say about them, and they have to speak for themselves. But I do see that many of them are putting a lot of safety measures in place in terms of just, when um, support and protection for their staff, making sure that there are rules in terms of who's coming into the facilities and who's allowed. So I do see that there are a lot of different policies that they're trying to put in place to protect our patients there, because these are really our, as you guys know, our most vulnerable population. So I think that's important. And a lot of the facilities that we work with closely, we do see a lot that they're doing to protect their residents.
That's great. And I think that we're all learning together, and institutions are taking measures to ensure safety of essential workers.
Yeah.
I want to go back to your time at MIT.
Yeah.
Because this is the MIT Club of Northern California. How do you think MIT has prepared you for this crisis?
Oh, good question. So I think one, I got used to running on not much sleep, so I'm totally prepared that way. I was probably, the problem sets and everything. I was not one to do them early for sure. So, but I think the more important piece is really learning to think outside the box. I don't remember many times where I went into an MIT exam and felt like, they taught me exactly this. But it was, oh, they taught me something and I'm supposed to apply this now. So a lot of that is what's happening right now, where we don't have a roadmap in terms of how we're supposed to treat the patients, what kind of systems and programs we need to build to best support our patients. So it's been a lot about taking what we've learned and applying it, and really measuring it, seeing how we're doing. So I think those pieces have really helped from MIT, just to learn how to apply our knowledge creatively.
Wonderful. And we have a question from the audience asking, after shelter in place gets lifted, how long you would personally start dining in restaurants again?
Oh man.
I know we're all dying to go back to our favorite restaurant.
Yeah, that's a good question. One of my favorite things to do is actually eating out at restaurants. My husband and I, that is one of our hobbies that it's been hard to give up. I would say personally, I would wait a while. There, unless I'm sure that when they open up, there will be a lot of measures to, do symptom checking, making sure that people are spread apart, making sure that their employees are symptom free. I do think there will be a lot of regulations to help protect, and then, outdoor dining, whatever there may be. Probably there will be some measures in there. So, but I personally think I would wait some time, because, you're not really, when you're eating, you're not wearing your mask, depending on how big the restaurant is, not, you may not be as, you may be a little bit close to the people around you, but I think eventually we'll have to open up and we'll have to see how it goes. But I'm sad to say I personally may wait a while to go, but I'm excited for the prospect of that happening again, because we do love eating out.
Great, and especially being in LA, that's tough because you're surrounded by great food.
Absolutely. But, you know, there are lots of great takeout options as well.
Mm-hmm. And I have a question going back to your experience at UCLA and being medical director and leading the clinics. Is the sentiment different at the leadership level and in the C-suite of the hospital where, again, going back to the theme of everyone, this is completely novel. There's no playbook. There's no roadmap. And as leaders, you have to stay calm, right? And you have to exude that confidence and let that trickle down to the hospital. So has that been a challenge to keep your poise and keep your calm and confidence in this crazy, uncertain time?
I think at the beginning, everyone felt like there was a lot of uncertainty, but, you know, as we learn more, as there's a lot of preparedness at our institution, which we're fortunate about. There's there are groups meeting multiple times a day to just make sure that we're as ready as we can be and we could think about all possible next steps. So I do think being in an institution where you have that trust in the institution helps a lot, and it helps with, I think, the morale of the frontline doctors when you really think that, when you know that the leaders are looking out for best interests and making sure that everyone's protected. I do think everybody, when there is uncertainty, initially it's always hard to be calm about it. But I do think once everyone had an opportunity to let this sink in, understand, okay, yes, this is what's going on. There's nothing we can do to turn it around. I do think we saw a lot of that effort go into organizing and making sure that we have a very robust response across the whole organization. I would say from the front line to the leadership to everyone that is engaged with our institution, I've seen a very robust response. So yeah, I think it's always hard to be confident when you don't know things, but it's also, I think part of it, being transparent when there are things you don't know also can be comforting for those that are working with you, that that they know you're being honest and you're being transparent about what we do and what we don't know, and having confidence in your organization that they're really talking to you every step of the way.
Wonderful. And I know there's been a lot of talk about PPE all over, and do you feel like that situation is getting better and that you're getting the PPE that you need for this marathon?
Yeah, I do think, at our institution, there's been a robust response to this. So we feel on the front lines, we do have the PPE. Whether or not every hospital, every region has that, it's probably variable. I do think we're collectively in a better place than we were when this first started, because people have had a little more time to organize and coordinate. So we are in a better spot, but it's going to be an ongoing discussion, and even the level of PPE. So, in certain cases, what might be recommended is a gown, a surgical mask, and gloves. And in other situations, what might be recommended is an N95, a gown, and gloves. So even as those recommendations are, the CDC really has been helping to guide that, but I think it's important for us to really pay attention to all the changes and make sure that we're integrating what we see in the data and what we see in the studies into these policies of what level of PPE is recommended for providers.
When you talk about the data and your sources, are you talking about CDC, IHME, Johns Hopkins, all of the above?
Yeah, all of the above. It's every institution that's doing research in this area to looking at infectivity. It's all the clinical trials. I think we have to keep up on that and let the data guide our decisions and guide our understanding, because there are a lot of thoughts and a lot of ideas and a lot of some are right, some are a little bit less so, but just making sure that we're staying updated and in tune with the data and letting that guide our policies.
Sure, that makes sense. And then who is UCLA collaborating with? Does UCLA work with the other UC systems like UCSF and other hospitals within the state?
Yeah, well, UCLA works very closely with all the UC systems and with county, and they have done so with almost everything, not just COVID, but everything else too. So that continues.
Okay. And do you feel like the sense of collaboration is changing? Because you mentioned earlier on the call that, you're talking to colleagues all around the world. Do you feel that sense of collaboration changing through this pandemic?
Yeah, I do think people are connecting. Personally, I've connected with a lot of colleagues that I may have trained with and now are at different institutions that we haven't talked in a really long time, I would say. It's been nice to connect with them, to really learn best practices and what everyone's doing across the country, seeing what the differences are. Hopefully it's something that we continue, not just COVID, but for everything. But this is just an especially important time because there isn't as much known about that. So, likely there has been more because of that.
Great. All right, I'm going to take one more question from the audience and then we'll close out. Let's see, we have a question about, We have a question about ventilators. This is an interesting one. Why does death rate climb so much after a patient is put on a ventilator?
For that, I don't think it's necessarily because they're put on a ventilator. I think we just have to think about who we put on ventilators and how sick they are when they're put on ventilators. So again, I think it's just really looking at the clinical situation.
Okay. All right. Well, thank you so much for, I know that right before this call, you are on a patient emergency call and, you're really in the thick of it right now. Really appreciate you taking the time to be with us. We really, we have the utmost respect for those on the front lines and especially those of our own who are part of the MIT community. Thank you so much. Any parting words of wisdom for the audience that you would like to leave us with?
Well, I think just making sure everyone's taking care of themselves during this time, not just physically, but mentally. It's hard. It's really changed everything in our lives. Some lives have been turned completely upside down. So I really do hope people take this time to connect with those that they love and those that, your colleagues, and make those meaningful connections now, and also connecting with yourself. I do hope this also gives us an opportunity to take a second and really reset and just think about what your goals and values are, and it doesn't have to be even COVID related, but I think everyone's been going at 1,000,000 miles an hour, so it just does give an opportunity to be more reflective. So other than that, I do hope everyone stays well and safe, and I'm happy to connect with you outside of this podcast as well, or this Zoom meeting. But thanks for having me.
Thank you. We will continue exploring the great indoors of our home while you are busy at the hospital. Thank you so much, everybody. Stay well.
All right, take care. Bye-bye.
All right, bye.